Hi everyone, welcome to our third episode of Hot Seat, this time featuring consultant clinical oncologist Dr. Chih Kiang.
Hi, Dr. Tan. Welcome to the show.
Thank you.
And joining me as well is the lovely Michelle.
Nice to see you again, Ben.
Thank you. And for this episode, we will be talking about cancer. So maybe doctor, you can share with us, as a man, as an oncologist, what is cancer all about? So with that, let's start with our first question for this episode. Doctor, what does an oncologist treat?
Okay, an oncologist actually treat cancer in simple terms. Of course, there are different types of oncologists, right? At least in Malaysia. So we have medical oncologists. So what they do is that they actually use drugs or medication to treat cancer. And we have radiation oncologists. So they use radiation to treat cancer. Of course, we also have surgical oncologists, which are mainly the surgeons dealing with different types of cancer. So the surgeons will operate on cancer cases. And of course, for myself, I'm a clinical oncologist. So I do both the work of a medical and a radiation oncologist.
So, Doctor, Ben and I were just chatting before the show. We all understand that, cancer is on the rise, but, we ourselves are quite scared to get ourselves checked, annually. So we want to know what are some of the cancer signs, right, that most people ignore or unaware of.
I think the danger about cancer, or the scary bit about cancer, is that at the early stage, most of the patients do not have any sign or symptoms, right? Unless you purposely go and do a screening test to try to look for any specific cancer, right? And actually, there's no one test where you can actually do and then to say that, oh, you have certain cancers or you do not have certain cancers, right? So you have to really re-stratify, meaning that based on your age, based on your gender, based on the risk factors that you have, then you specifically go and look to do certain tests to rule out certain cancers. And of course, the test or screening test that you do to rule out all these cancers are different. For example, say breast cancer, right? Which is the commonest cancer of all. So I think the only way for us to do that is like to do a mammogram or an ultrasound to rule that out. Whereas the second commonest cancer, like colorectal cancer, then actually you don't do mammogram, you don't do ultrasound, right? So you do something like you take the physical material and then you send for what we call whether there's any presence of blood in it. And of course, if let's say there is, that patient will need to go and do a scope, of the colon to see whether is there any tumors inside and all. So what I'm trying to say here is that different cancers, you need to do different screening tests to rule that out, right? So unless you actually go and purposely ask for certain tests, right? Otherwise, if you were to wait till you have symptoms, most of the time, when you come to the diagnosis of the cancer, it will be at a later stage, unfortunately.
So I also think, speaking of, understanding and confronting this sort of confusion and the fear, one thing that we normally do at our Hot Seat episode is this part called Cancer Mythbusters, where we try to eliminate...
to dive into it.
We try to get rid of any misconception or, things that may be true or false. So here we've already prepared a few burning questions from where we found online. So, okay, first Cancer Mythbuster question. Too much microwave food can cause cancer. True or false?
I'm super curious.
It's false. I think there is no scientific evidence to prove that if you eat a lot of microwave prepared food, then you have a higher chance of getting cancer. So I think the answer is false.
Okay. Is there traditional healing or, alternative methods that can cure cancer? How effective are these, doctor?
I think Malaysia, being someone who practiced in Malaysia, and I think Malaysia is a multicultural country, right? So there is a lot of patients who actually will seek alternative treatment. Sometimes they do it together while they are on treatment with the Western doctors. Sometimes they do it on its own, without seeking the treatment from the Western doctors. So I think why they are doing that is because normally they are being promised cured, without side effect of the treatments, because they are being given a natural treatment and all these things. So I think based on my experience, for many, many years dealing with patients who are experienced using all these alternatives, I think generally, number one is that none of these alternative treatments can actually replace Western medicine or Western treatment for cancer. For example, surgery, right? If a patient requires surgery to cure the cancer, I think there's no alternative treatment available which can actually replace surgery itself, right? So that's one. In terms of, based on my experience as well as discussing with my other traditional or what we call Chinese medicine physicians, certified Chinese medicine physician, I think generally we do agree that this Chinese medicine or traditional medicine actually doesn't cure or treat cancer. Their role are mainly to supplement or complement the Western medicine, in dealing with the cancers, but they help to, regulate the patient's general well-being. They help to reduce some of the side effects that the patient have because of the Western medicines that are being given by the oncologist. So generally their role is more like a supporting rather than taking the mainstream as a main treatment, to cure or to, control the cancer itself.
Yeah, to support and not to replace.
Yeah, that's an interesting answer. Does a positive attitude help to cure cancer faster?
I would say a positive attitude helps in everything, right? So whether how much and how it actually helps, I don't think I have a scientific explanation to that. But I think with the positive attitude, positive mindset, it definitely does helps in terms of the patients going through the treatment, how they overcome the treatment side effect, how they are going to deal with the disease diagnosis itself, going through the journey and all. So I think with the positive attitude, definitely it helps the patient to undergo the journey more easily, as well as, able to complete it without much of a problem. Yeah.
I have a very, this may sound a bit noob, but you can share your thoughts as well. So my grandfather succumbed to cancer. He had stomach cancer and he passed on. But I have a lot of family members. None of them have cancer. So I was just thinking that, okay, maybe the chances of me getting cancer are very low lah. Yeah. So my question is that what role do genetics play in cancer risk? But what do you think, Ben?
Yeah.
Do you also have that thought as well?
Yeah, my grandfather had lung cancer, though I suspect it's because he is a heavy smoker and he passed away due to the lung cancer. So I also don't know like how much is genetic. Like, is it too many people in my family tree smoking, then suddenly I don't smoke, I also turn out? So is there like a mathematic formula on out of this family member, this number have cancer, so that means your chance is this? Is there anything then?
Unfortunately, we don't have that kind of calculators or calculations on that, right? So in general, right, I would say that 90 to 95% of cancers are not due to genetics, right? So it's mainly because of, example, our lifestyle, food, stress level, lack of exercise, eating a lot of unhealthy foods, of course, aging. So as we go along, as we get older, I think with all this exposure to all these pollutions and things like that, that will actually increase the chance of someone getting cancer itself, right? If you're talking about purely based on genetic itself, I think there's only about 5% or so of the cancers are due to genetics. Because if you say that, say someone has a grandfather, has colon cancer, for example, and the grandfather has the colon cancer at age of, say, 70, right? That actually doesn't mean that this patient will have much more higher risk of getting colon cancer. But as opposed, say the same person, you'll say that, oh, maybe my uncle or my cousin, a few of them actually got cancer when they are in their 30s or early 40s. Then yes, so there's a high chance that this person might have a higher risk of getting cancer because of some genetic issues. So for generally patients who has cancer because of genetic problem, right, mainly they will have more severe cancer. That means that when they present, it will be at later stage, as well as at a younger age, right? So cases like that, then they might have the cancer because of underlying genetic problem. But if you are talking about elderly patients in their 60s, in their 70s, when they have certain cancers, or say, for example, a heavy smoker having lung cancer, so most of the time these are due to the non-genetic causes.
Let's talk about like possible trends, I think. Do you think that there has been a rise of cancer among the younger generation?
I think if you look at our own Malaysian local data, I think definitely you are seeing a trend of that. Okay, but whether is it because of purely cancer are happening in much more younger group of patients or not, I think we are not too sure about that. Is it because of the earlier exposure to a lot of unhealthy lifestyle, hence leading to more younger patients having cancer itself? I think that is something that we think might be, but it's not proven yet. But one thing for sure is because of the awareness, right? I think being the younger generation, now that they are more aware about all this information, knowledge about, screening tests, about cancer and all. And hence, I would say that coupled with the more easily accessible, because a lot of hospitals are offering all these tests and all, so a lot of people have easy access to hospital, and hence more people are actually going for screening tests earlier. And since you are picking up more of this cancer in the earlier, younger group age patients.
So it can happen to anyone, and there are various factors, and genetics is just one of the causes. So talking about prevention being the key, right? Doctor, maybe you can share some of your lifestyle habits and practices that can help in cancer prevention. Share with the audience.
I think basically like what I mentioned earlier, I think healthy lifestyle. When you talk about healthy lifestyle, meaning that I think in general, I believe everything in moderations, right? Not excessive in whatever. Right? Of course, I think when you talk about healthy lifestyle, doesn't mean that you cannot take nasi lemak, you cannot take roti canai, you cannot take teh tarik, you only drink plain water, bread, and things like that. It doesn't mean that, right? So what I mean is like moderation, meaning that probably you can have like roti canai is probably like once every month or once every 2 weeks. But at the meantime, also eat less processed food, eat more healthier, do exercise, sleep early, and things like that. So those things helps itself. The other thing is that always go and do screening tests. Right? I use the word screening test and I don't use the word medical checkup because there's actually a huge difference between medical checkup and screening tests here. So medical checkup, number one, is that medical checkup comes about is mainly to rule out heart diseases. So if you look at the things that is included in most of the medical checkup, it includes things like checking for your high blood pressure, diabetes, stress tests to check for your heart and all these things. Rarely you have any
cancer markers.
Really in the cancer itself. And like you mentioned, Michelle, about tumor markers, right? It's actually wrong perceptions that people felt like, I've done the tumor markers, everything was normal, hence I'm cancer free. It's actually completely wrong. Why is that so? It's because actually cancer markers being a tool for screening for cancers is completely useless, right? Why is that so? It's because of few reasons. Number one, not all cancer has the tumor markers, meaning that, example, someone has a esophageal carcinoma, nose cancer, right, in layman terms. There's actually no tumor markers. That's one. Second thing is that tumor markers are not sensitive or specific enough, meaning someone might have a cancer, but the tumor markers can be completely normal, right? And the third thing is that there are also people who have raised tumor markers, but actually they do not have cancers, meaning that the tumor markers can be raised because of non-cancerous causes as well. Hence, relying on tumor markers alone to say whether someone is actually cancer-free or not is completely false. Yeah, so I think, like I mentioned earlier in the beginning of the talk, it's very important for you to specifically ask for certain screening tests. Say if you want to rule out breast cancer, you have to do mammogram ultrasound. If you want to rule out cervical cancer, you have to do a pap smear or HPV test. So different cancers, you need to do a specific screening test for it, but not tumor markers.
Before we wrap up the session, Dr. Tan, do you have any last words that you want to share with our audience out there?
So I think number one, go and do screening tests, right? If let's say you have reached certain age group and that you have a risk of developing certain cancers, because early diagnosis at earlier stage will make a lot of difference in terms of curing the patients and the chance of curing it. Once you're diagnosed with a cancer, please talk to the doctors, right? Find out about what is the condition right now, what are the options of treatment, what are the pros and cons of all these options, and if you have any doubts, if you are not agreeing with one sort of treatment, please feel free, to get and ask for a second opinion, as well as to ask the doctors for alternative options, right? But please do not, just because you're trying to ask for a second opinion or third opinion or fourth opinion, delay the initiation of treatment as well, because prompt treatment is actually very important as well at the same time.
So before we wrap up the session, Ben, do you have any burning questions or Any more cancer mythbusters?
Okay, this is not so much a burning question, but more of an announcement to the audience, to the people watching. Be sure to like, share this video, subscribe to us if you haven't, and feel free to leave a comment down below. If you'd like to find out more about us, Hospital Picaso, you can always head to our website at www.hospitalpicasso.com or follow us on all our socials. So with that, Michelle, back to you.
Yep. Just want to say thank you to Dr. Tan for enlightening us with your invaluable and honest insights. I really enjoyed this episode. And to our audience out there, stay tuned. Our next episode is with Dr. Badrul, and he's going to be talking everything about urology. So till then, see you again. Bye.
Bye.